brain injury causes alterations in brain neurotransmitters, which are the hormones in your brain. So what we find is after brain injury is that people have very altered levels of brain neurotransmitters. And the one that's typically lowest is actually going to be serotonin. And then the second one is GABA gets really affected as well. I'm going to do a quick screen share just to kind of give you guys a peek. This is actually from our Stress Essentials line, and our Stress Essentials line really has the group of most of the supplements that I use and recommend in our program for brain injury recovery and for a lot of brain symptoms. Pro Mag X is the magnesium I'm going to be talking about. You guys have heard good things about magnesium, but most magnesium out there that you're talking about is magnesium citrate, which doesn't even absorb into, it doesn't cross the gut barrier into the blood very well. And it doesn't absorb in the brain really well. So your brain really needs a ton of magnesium. And magnesium is a cofactor required for hundreds of enzymes in your body. So what is the right kind of magnesium to feed your brain so it can work properly and heal properly? Is magglycinate, okay? So Pro Mag X is magglycinate, okay? And it is a giant ass bottle and it works really well, and it won't give you the runs or diarrhea because guess what? It's actually being absorbed. So it's a specific type of magnesium designed to absorb, to cross your gut into your blood barrier into your brain. So Pro Mag X is the product I usually recommend, and I personally take. I take 2 every evening. And magnesium is really important because it's going to actually decrease some of the excitatory things that are happening in the brain. So it's a brain calmer. So it really helps you have better quality sleep. It helps the enzyme activities in your brain, right? And it is incredibly helpful to reduce also anxiety, middle of the night awakening. And magnesium also is incredible. Magglycinate is incredible for pain in your muscles. So it crosses the gut barrier into your muscles and your brain. So it's part of our pain protocol, actually. So Pro Mag X is wonderful, and 2 of those at night would be great. Okay, is this helpful? I hope this is helpful. Maybe I'll talk about one other supplement, which is Mood Boost. That's probably my favorite. Mood Boost is really helpful because brain injury causes alterations in brain neurotransmitters, which are the hormones in your brain. So what we find is after brain injury is that people have very altered levels of brain neurotransmitters. And the one that's typically lowest is actually going to be serotonin. And then the second one is GABA gets really affected as well. So I love Mood Boost because it really attacks that whole neurotransmitter broken system in brain injury, because some of the ingredients in here, let's be real, we're talking about methylated B vitamins. Methylated Bs are going to be really important in brain neurotransmitter production. Mood Boost has methylated Bs in there, and it has 5-HTP, which is the precursor to make serotonin, which is frequently affected in brain injury. So you want more serotonin, you take some really good quality 5-HTP. And the other thing is we talked about GABA. You want more GABA, which is calming for the brain, right? And GABA, L-theanine is really helpful in supporting GABA, which is in here as well. And then there's actually GABA in Mood Boost as well. And there's magnesium in here as well. So lots of love. Most people in our program with brain injury will take 2 of these every night and for neurotransmitter support in the brain.